Hi, I'm Dr. Matt Rasmussen with Periodontics and Implant Dentistry of Tallahassee. I'm going to spend some time today going through the most common questions we have with bone grafting, specifically different types of bone grafting procedures, when and why they're done, and just other common questions that come up with patients regarding options. Bone grafting is a process where a material is used, typically bone, usually donor bone, is placed in certain places either around natural teeth or for the more specific purpose of today's discussion, when we're replacing teeth. So when a tooth is removed, for example, bone graft will be placed to maintain that oral environment so that it will be available for other prostheses in the future, including something like a dental implant. Natural teeth in the mouth are connected to the bone. However, like other bone-to-bone contact, there's a ligament that is between the bone and the tooth. The reason why I mention this is when a tooth is removed, the body knows there's no longer a tooth present. Now, think of your arm being in a cast. If the arm is not in the cast and you cannot exercise your muscles, there's a natural tendency for those muscles to shrink or atrophy over time. Likewise, if a tooth is not present in the bone, the body knows there's no tooth present and there will be a natural atrophying process. Bone grafting is a procedure that is performed at the time of removing a tooth that prevents or lessens the amount that bone will shrink. And this is important because we need that bone available if we're going to place a dental implant. A procedure that is commonly performed in dentistry is something called a ridge augmentation. What this is an area where a tooth used to be and there's not adequate bone, typically wide enough, sometimes not tall enough, that is available for the dental implant to be placed. A ridge augmentation is a procedure where we're going to try to regrow that bone so we have adequate bone available for dental implant placement. A ridge augmentation is a procedure that involves a series of steps. I'll break down some of the more common steps in this question. The beginning of the procedures will get the patient numb or sedated ready for the procedure. The gums will be open in that area to expose where we see the bone available. We will, quote unquote, wake up the bone, basically trying to get the body aware that there's a small injury in the area so it'll start to heal, and there's enough bone to be placed so that way the bone can be regrown in that area. One of the other steps that's involved is we make sure the gums are very loosely fitting over that area to allow for passive fit. A procedure that is also used to build bone in the back part of the upper jaw is something called a sinus lift. The maxillary sinus is a natural place that sits above your back teeth directly to the side of the nose. In that cavity, sometimes that sinus will grow down into the area where a dental implant needs to be placed. If that's the case, then we can do something called a sinus lift to add additional bone to gain height available for dental implant placement. A sinus lift procedure can be performed in a few different ways. If there's a small amount of bone that needs to be grafted or a small amount that needs to be gained, then there's something called a localized sinus lift. That's typically done at the time of dental implant placement and is a very small and relatively straightforward procedure. However, there's a larger procedure, something called a lateral window sinus lift. That's a more involved procedure, and that's the one that we'll go into for the scope of this discussion. Typically, a lateral window sinus lift is performed by opening the gums in that area, typically on the side of the back teeth above where those teeth exist. There's a window being made. So basically, we work into the bone so we have access to that cavity. There's a small lining of that area that we're going to lift. And then once that's done, bone and membrane are placed to ensure that the graft is there and contained, and the area is sutured for full closure. There are a number of different bone materials that can be used for grafting procedures. Typically, one of the most common ones is donor bone. There may be other types of bone used as well. Oftentimes, there's something that's going to help maintain the space as well. So there could be something like a mesh or a membrane or something that's going to basically make sure that the bone stays where it's supposed to stay and the gums stay where they're supposed to stay. Bone grafting procedures can vary in the overall recovery time. Some patients report after a bone grafting procedure with our simple removal of a tooth that they don't report much discomfort at all and have very little recovery time. For the more significant procedures, such as a ridge augmentation or a sinus lift, we typically recommend the patient wait about a week or so before doing anything more significant. Most patients will report discomfort going up for 2 to 3 days, where they hit their peak amount of swelling and discomfort, which can be controlled with pain medication, and then 2 to 3 days coming back down. With any surgical procedure, there's always some risk. Depending on the invasiveness of the procedure, there can be infection or other postoperative complications associated with the procedure. Again, with something like bone grafting after a tooth removal, this is very unlikely. With ridge augmentation or sinus lifts, depending on how much bone we have to grow, there can be some risk of infection postoperatively that may need to be managed with antibiotics. It's critical to have a 3D scan to let the doctor evaluate whether you are a candidate for bone grafting procedures. As this is a more nuanced discussion, my strong recommendation is that you make an appointment to have the doctor review the scans, discuss with your medical history, and see if you are indeed a candidate for bone grafting procedures. I hope we've had a chance to answer some of the most common questions regarding different types of bone grafting procedures. Now, again, we covered a number of different types of procedures, and you'll have specific questions regarding your individual circumstance. Give us a call at area code 850-692-9200. We look forward to meeting you and discussing any questions you have and getting you to better oral health.